Citizens and residents of Kwara State have been advised to work hand in hand with health workers in the various communities. This partnership, if incorporated, will go a long way in improving healthcare services and delivery in the state. This call was made at the media roundtable meeting of the Network of People Living with HIV/AIDS in Nigeria, NEP1, held in Ilorin.
So if you are still comfortable.
In his opening remarks, Femi Olatunbosun, the coordinator of Kwara State chapter of ACOMIN, enjoined people at the grassroots to shun self-medication, stigmatization, and underutilization of health facilities.
As a result of this project, we have been able to raise the mind of the community people and even the health workers towards attitudinal behavior, towards attitude behavior towards the client that comes into the facility. And we have equally make the community people to be aware that there's need for them to actually work with the health workers at their facility, to see the facility as their own facilities, and at the same time to ensure that wherever they see the signs and symptoms of all these three diseases, they should try as much as possible to go to the facility, not to start taking treatment on their own.
Olatunbosun further revealed that the selected CBOs are those who worked in the 5 local government areas, which include Ilorin South, Ilorin East, Ilorin West, Moro, and Idu local government areas.
Health is a very serious challenge in our society. Let's play our part. Let's do the needful. Let the government play their role. Let the community people play their role. Let the CSOs too play their role, like what we are doing now. And any other stakeholders who are working in the health sector should see it as a thing of concern, as a thing of humanity, that we are serving the humanity. So with this, the mind of every citizen will be open to better health.
For his part, the Kwara State Coordinator, Network of People Living with HIV/AIDS in Nigeria, NEP1, Alhaji Yusuf Mukhtar Animashaun, also encouraged community members to support government efforts to eradicate the spread of HIV/AIDS and other infectious diseases through effective sensitization and advocacy.
Engage the clients who access care in those facilities to know whether the services rendered by the facilities have some sort of quality. So that is what Global Fund wants us to understudy, to see whether the services, given by these primary health care centers in the locality really, offer quality services in the area of COVID-19, HIV/AIDS, tuberculosis, and malaria.
Alhaji Animashaun pleaded with people to shun stigmatizing people living with health conditions like AIDS, tuberculosis, and others.
The project has the component that address the issue of stigmatization and discrimination. That is why we have GBV component. And the component of that GBV is to sensitize the entire community, especially women. Because when you talk of GBV, it's really centered on women, not only women.
Also speaking at the event, the program officer, Mr. Opa Robert, revealed that the program, through the help of community members, has been able to record success rates in the 5 local government areas, announcing further that the program has projected other viable initiatives to improve sensitization in the coming year.
What we are doing, we are making the communities to take ownership. Because what the idea is, it's a government thing. But the government, you are the one who assesses care there. So the community are gradually seeing that this is their own thing, and they have, if you leave it and it spoils, it's your own. Because we want to save life and at the time improve service delivery, quality of service delivery. And in the sense that you cannot be somewhere in Ikporu and you are having issues. and you want to run to teaching hospital. Look at the gap, the distance and the rest of them. So if the facilities at the PhD level are functioning, a whole lot can be done and a whole lot of lives can be saved.
The briefing had in attendance executive directors from the community-based organizations, CBOs, and relevant stakeholders within the health sector in the state.
So we've been able to talk to the community people to encourage themselves, because one of the things we found out on this project again is community apathy. That is, the community don't want to go to the facility. Everybody that believes in the traditional way and things like that. And for coffee, for instance, they will give shea butter and red oil. But at least so far so good. We've had increase in patronage in all the 5 local governments. We're working with 3 CBOs are working in 1 local government.
We've been able to drive the Yalagwe way, renovate the clinic for them, give them, improve their water supply that wasn't anything to write home about before.